The work has been done retrospectively on samples from patients, about 200 patients with anal cancer, 300 plus squamous of the oropharynx and 300 plus squamous of the cervix cancer. The question we were asking is, knowing that the etiology of these tumors is similar and they're all linked to virally associated causes, if we would find similar molecular pattern and basically portfolio among these cancers. What we did is by performing IHCs and next-gen sequencing and FISH amplification on certain genes of interest, so basically a platform of our genes of interest and our proteins of interest based on prior studies on cancers. And we compared the presence of mutations and amplifications as well as protein expression among these three tumors. The results of this study showed that there is significant similarity among these three tumor types, in a sense that neither of these mutations or protein expressions were statistically different among these three cancers. Also, we looked at PD-L1 and PD-1, and we find similar expression levels in all three tumor types. We concluded that as historically, we knew that the patient population had similar risk factors, and then more recently we have learned that that risk factor had been secondary to infection by HPV. At the genomic and proteomic levels, we see similar profile, basically, very similar profile, I should say, which abides the question that how we can extrapolate and how we can learn from our experience in some of these diseases and the other diseases, for example, anal cancer being a much less common disease compared to cervical or oropharynx HPV-related cancer, and how can we actually explore new therapeutic options in these diseases.